Hello, my name is Barb Schmidt. I am a member of the Minnesota Deaf Hospice team. 7 other people also belong to the hospice team. We established our Deaf Hospice team in 1998 to help deaf people who have been admitted to hospice care and to teach hearing professionals like doctors, nurses, and other hospice workers that deaf patients may have very different needs than hearing patients. We also want to make sure that deaf people know their rights when it comes to health care. You have the right to determine how you want to be cared for as you near the end of your life. You do not have to rely on hearing doctors or other hearing people around you to make your decisions for you. You can make your own decisions. I am a founding member of the Minnesota Deaf Hospice team. I'm hard of hearing and I graduated from the deaf school in Minnesota. I went on to attend Gallaudet College for 1 year and then married. I have 3 children and my husband is now deceased. My 3 children are all hearing, as are my 7 grandchildren. The purpose of this videotape is to give you an idea of how we set up our program and how you too can set up a hospice group in your state. Hopefully, you will want to develop a deaf hospice team so that you can take care of your people and your friends. You don't have to let hearing people take control. It is time now for all of us to be independent. I'd like to take a moment now to explain why in Minnesota we chose this sign for hospice. To show you why we chose this sign, I will sign a poem for you. Of course, this doesn't mean that you have to use the same sign. Here's the poem. Blessed are you if you can serve others. Your heart is touched, and your heart shows love. Blessed are you if you can serve with your heart, for it is with your heart that you see the need to serve. That's the sign for hospice, helping others with your heart. This workshop will explain healthcare directives and hospice care. I will explain the meaning of these words so that they are very clear to you. In Minnesota, the terms living will, healthcare directive, and advance directive all refer to the same thing. These terms have changed over the years, and other states may use different terms, but in reality these terms are all interchangeable. Now I'd like to talk about healthcare directives. I'll explain what healthcare directives are, whether or not you need them, what decisions you need to make, and who should know about your decisions. I'll explain that clearly. Healthcare directives are instructions you write down. The instructions contain information about your healthcare wishes as you approach the end of life. Healthcare directives are only for serious medical situations, for times when you are so sick that you can no longer sign or speak for yourself. And remember, it is not good enough to just tell somebody your instructions. You must write them down on paper. I'd like to tell you a story that explains why it is important to write down your healthcare directives. The story is about Eleanor, an 80-year-old woman who had 2 daughters. Toward the end of Eleanor's life, she became very ill and went into a coma. She could no longer speak for herself, so the doctor approached the 2 daughters and informed them that they were faced with 2 choices. One choice was to prolong Eleanor's life by putting her on a respirator to help her breathe easier, to give her IVs and food through a feeding tube. The other choice was to keep Eleanor comfortable until she died. The 2 daughters turned to look at each other, and one said, "I think we should make Mom as comfortable as possible and let her die." The other daughter said, "Absolutely not. I want to do whatever has to be done to keep Mom alive as long as possible." Eleanor's 2 daughters obviously had a conflict about what to do. At this point, the hospital social worker came in. Realizing the daughters were struggling about what to do, she asked them if their mother had ever signed a healthcare directive. The daughter said no. Do you think the conflict could have been avoided? This next story is about a man named Wally. One day, Wally gathered his family to discuss his wishes. "When my time comes, I don't want to be kept alive," Wally said. "I've lived a good life. When it's time, I feel fine about dying naturally." Wally's family accepted his decision. It's interesting to compare Wally's story with Eleanor's story. Wally's family knew what he wanted, while Eleanor's daughters had a hard time coming to an agreement because they did not know what their mother wanted. You can see by now that you will have to make some hard decisions. But you may be saying to yourself, "Why in the world should I fill out an advance directive now, when I feel perfectly fine? What's the point, when I could just wait until later?" But is that a good idea? As you begin to write out your advance directives, you will need to do some very hard thinking about what your values are and about what is most important to you. As you near the end of life, there may be things that you worry a lot about. Perhaps there are things that you regret that you did not do, or maybe didn't finish. Some people may think about their faith and their relationships with God. I'm sure that many of you have questions and concerns. When we talk about dying, many of us begin to think about our fears. What do you fear the most? Yes, death itself is a fear. Other ideas? Pain is another common fear. What are some other things you may worry about? Perhaps it's money and what to do with your money, or fighting amongst your children, and even your house. Should you sell it or give it as a gift? There are many things to worry about, and that is why it is important to start planning now. Advance directives and living wills are like life insurance. There was a gentleman that came to me and asked if they had to do with money. I said, "No, living wills have nothing to do with money. It has to do with your life. Living wills are connected with your life as you near death. They let your family, your friends, maybe even a neighbor if you don't have family, and your doctors all know what you want for yourself as you near death. That's what you write down. It's like life insurance, but it doesn't have anything to do with money. And when you sign an advance directive, your family and your friends will have less stress because you've made your decisions and they won't have to make them for you. It will reduce your stress and take the burden off your family. You saw what happened with the two daughters. The mother didn't document her advance directives and they became estranged. So when you sign an advance directive, you and your family will both have less stress. You will have less stress because you know that your wishes will all be followed. Now I'd like to tell you a story about a man named Bernie. His story illustrates why thinking about your values is important when you're considering your healthcare decisions. Now Bernie was 75 years old and had a life-threatening illness. In his youth, Bernie had been a talented Olympic track and field athlete, and he was very proud of his body. When his health began to fail, he lost the circulation in his legs. His doctor suggested that they should amputate so that Bernie would not die as quickly. Knowing how Bernie felt about his body, do you think he would want his legs amputated? When he was asked, he said no. I want to leave this life with my whole body, even if it means not living as long. Shortly afterwards, Bernie was admitted to hospice care, and he passed away. And that's what I mean when I say that you need to think about what you value. Now I'd like you to ask yourself, who will you trust to make medical decisions for you if you become too sick to make them for yourself? You may not be able to speak or write as you near the end of life, so you will need to choose somebody that you trust to make your decisions for you. You can choose anyone you like. You can choose a family member, such as a son or a daughter, or you can select a relative like an aunt or an uncle or even your cousin. Perhaps it would be a close friend or a minister or someone that you have worked with. You can choose any person that you like, but remember that your decision on who to trust is critically important because this person will be responsible for speaking for you when you cannot speak for yourself. There are many different terms used to talk about the concept of a healthcare agent. You may see this person referred to as a surrogate, as a proxy, a representative, or sometimes a durable medical power of attorney, or POA, an acronym I'm sure you've seen before. All these terms essentially mean the same thing. They refer to a person you select to follow your wishes. How will you decide who to choose as your healthcare representative? You can choose anyone you want. It doesn't matter if that person is hearing or deaf. What's important is that you pick someone who you are comfortable with, and that your representative is someone you know well and that you can trust. It's also important to select a representative who will be confident and strong. This person needs to be strong in order to stand up for you and your decisions when you are too sick to do so yourself. Remember that both you and your healthcare representative both have the right to an interpreter. An interpreter can be made available to you and your healthcare representative to tell you both what the doctors and other hearing people are saying about you and your medical care. Again, what's most important is that you write down your healthcare wishes, go over your wishes with your healthcare agent, and make sure that your healthcare agent is strong enough to defend your decisions and ask for an interpreter. The most important thing to do after you select a healthcare representative is to sit down across the table with them and very clearly discuss the details about what your healthcare wishes are. Discuss with them what you want when you are too sick to speak for yourself or at the end of life. Make sure that you both understand each other. You will feel less stress and feel at peace if you're clear with your representative and write your wishes out ahead of time. When a deaf person is sick, they may sign very sloppily. They may be too weak to lift their arms and hands, but another deaf person should be able to see what they're trying to say and can tell the doctors what they are signing. That's why it's important that the person understands you and can follow your wishes, so they can anticipate what you will ask. Let me tell you a story to serve as an example. There was a woman named Mary, and she had a father named John. Mary's parents were both 85 years old. Mary had been encouraging both her parents to fill out their advance directives, but Mary's father would say, "No, we don't need to do that. Your mother will know what to do and can make decisions for me when the time comes." But when the time actually came, and Mary's father was nearing death, Mary's mother was terrified and couldn't make decisions about life support. John's doctors had to make those decisions for him, and they opted to prolong John's life with life support, because the medical profession considers it their ethical responsibility to prolong life unless they are instructed otherwise by the patient or the patient's family. After many hours, when it was clear that John would not live, the doctors did decide to withdraw life support. But in the meantime, John did suffer. He was in a lot of pain. By not documenting an advance directive, Mary's mother was faced with difficult decisions that she was not prepared for. I have another story to share with you about a man named Tony. Tony lived next door to a deaf man. They were friendly, and they would wave to each other across the fence, but they didn't know each other well and had never socialized. One day, the deaf man was sitting in his house, having a cup of coffee, when he saw an ambulance pull up to Tony's house and take him to the hospital. He was surprised that the ambulance had to come and get Tony, and was curious about what had happened. Later that day, the deaf man's phone rang, and he answered on his TTY. It was someone from the hospital who asked him, "Do you know your neighbor Tony?" "Well, yes," he replied. "Did you know that he selected you as his healthcare agent?" The deaf man was stunned. He didn't think it was right that Tony had never let him know, not to mention that he didn't really know Tony, and certainly was not in a position to make healthcare decisions for him. As you can see by this story, it is important that you inform the person that you choose as your healthcare agent. Don't just select someone and then never mention it to him or her. Write down your decisions. This is a story about Anne. She is the only deaf person in her family. Anne chose a deaf friend to be her healthcare agent. She wrote down her directives and spent time talking to her friend about her wishes. Anne then told her family who she had chosen to represent her if she ever became too sick to speak for herself. For Anne, it was important that her hearing family know and accept her decisions, so they could respect her wishes. Anne predicted that her family would be angry that she chose a deaf friend over a family member, so she took time to explain her decision to them. She said, "My friend knows what I want, and I trust that she will follow my wishes, but it was important for me to let you know. It's important to let all people who might be concerned know, so that it won't be a surprise." It's important that you give copies of your advance directives to different people who you trust. You should give a copy of your advance directive to your healthcare agent. but you can also give copies to your doctor, your family, and your friends. I also think it's important to keep a copy in your home in a safe place. Do you have any ideas for a safe place? A personal file is one idea, and that's fine. Other ideas? A bank? No. You should not put your advance directive in a safety deposit box. Safety deposit boxes are not accessible to anybody for 6 months. I would not recommend that. Does anyone have any other ideas? A bedroom drawer would be fine. But make sure that you also leave a note to remind yourself where you put your advance directives. You may also want to place a note somewhere easy to see, like the refrigerator. So if a doctor, or your family, or a paramedic comes into your house, they will know where to find your advance directives. Be sure to protect yourself, but don't put it in a bank. Now we're going to talk about making medical decisions, as far as what type of medical treatments and procedures that you might want or not want. I was once invited to go to a hospital in Minnesota. While I was visiting in the intensive care unit, I was just amazed at how the intensive care unit had lots of machines and equipment to help keep a person alive. They have respirators, heart monitors, IVs, and lots of other machines. You name it, and it was there. And it was all monitored by the front desk. The nurses could watch the computers and monitors from the nursing station and make sure that the patient was doing all right, while not being in the room physically. There wasn't a person there, but rather it was machines and computers. Now I'll tell you a story about a woman who had trouble understanding some medical terminology. Once a week, a healthcare worker would come to her home and help take care of her. One day she asked the woman if she had filled out a healthcare directive. The woman said, "I confess, I just don't understand the medical terminology." Technical and medical terminology is difficult for most people to understand, whether they are deaf or hard of hearing. Because of this, the Minnesota Deaf Hospice team put together a very comprehensive glossary. The glossary explains these medical concepts for you. We sell this glossary as part of a booklet at our workshops. We place it on the table in the back of the room and sell them for only $2. They explain the terminology so it is clear and easy to read for all people. As I indicated, hearing and deaf people alike have difficulties understanding complicated medical terminology. Do you know what DNR means? DNR stands for Do Not Resuscitate. The word resuscitate means to bring someone back to life again using some form of CPR. DNR therefore means if someone's heart has stopped beating, do not bring him back to life again. Here's another acronym, DNI. Do you know what that means? DNI stands for Do Not Intubate. The word intubate means to help you breathe again, using some kind of tube like a respirator. DNI therefore means Do Not Make Me Breathe Again. There are so many complex medical terms, and that is why the Minnesota Hospice team developed our $2 medical glossary. Here's something interesting for you to think about. Do you know the TV show ER? Sometimes you will see patients being resuscitated on ER. They come back to life again and everything is fine. In fact, this is usually not true. In real life, only about 6% of people who get CPR actually come back to life again. And sometimes, if a person is successfully resuscitated using CPR, they often may suffer some brain damage or even end up in a coma. Another term, life support treatment, can be confusing to many people. It really refers to a lot of different ways to help keep people alive. Life support can refer to machines and various kinds of equipment used to sustain life. Some of the equipment was designed to help keep your heart beating. Other machines help keep your lungs working when you are not able to breathe on your own. A treatment means a medical procedure. So if you put the words all together, life support treatment is a medical procedure that uses equipment to help your heart and lungs work when they are no longer able to function on their own. Have you seen the acronym CPR? Earlier I told you that DNR means do not resuscitate. So if you say that you want CPR, it means that if your heart stops beating, you would like to be resuscitated. It helps to break down the English words. The word cardio refers to your heart. The word pulmonary refers to your lungs and your breathing. And as I said earlier, resuscitate means to bring back to life again. Altogether, CPR stands for helping your heart and lungs work on their own again. Now let's suppose that your heart stopped beating. When the ambulance arrives, the paramedics would need to revive you. They might perform mouth-to-mouth resuscitation, or they may need to use electric paddles to restart your heart. Lastly, they may have to give you a shot of medication to stimulate your heart to start beating again. These are the 3 different methods that paramedics might use to try. We've gone over DNR orders already. DNR orders refer to do not resuscitate orders. A DNR order is a written order from the doctor for people who do not want CPR if their heart stops beating. They are only for people who are very ill or near the end of life. The reason people have their doctors write a DNR order is because when you go to the hospital, the medical staff are obligated to perform CPR, whether it will help you or not. But if you have a DNR order and a doctor doesn't think CPR will save your life, the medical staff is not obligated to perform CPR. Suppose you have a DNR order and you were in an accident. The paramedics will still perform CPR at the scene of the accident before taking you to the hospital. Then, at the hospital, the medical staff will follow your written advance directive wishes. You do have to inform them of your wishes ahead of time. I hope the differences between the two are clear. When you are nearing death, another thing the doctor may consider is a feeding tube. A feeding tube is a small tube that goes into your stomach, either through your nose and throat, or by making an incision in your abdomen. This surgery can be painful, but feeding tubes are used to help sustain a person's life. This next story is about a man named Jack. He was fed through a feeding tube. Remember, a feeding tube can go through your nose and throat into your stomach, or a feeding tube can be inserted directly into your stomach through your abdomen. When Jack was 63, he had a stroke that made it very difficult for him to swallow. The doctors felt that Jack's chances for a full recovery were very good. Because of this, the family decided that the doctor should go ahead and insert a feeding tube. Jack's condition eventually improved, and in time he was able to swallow and eat again on his own. Results like this are possible. Now I will tell you a different story about a woman named Joan. Joan was 71 years old. and also suffered from a stroke. But her stroke was very serious. She had severe brain damage and also could not swallow. The doctors did not think that a feeding tube would improve Joan's chances for a full recovery. The family accepted the doctor's prognosis, and rather than giving Joan a feeding tube, they chose to keep her comfortable until she died. These are two different stories, one about a person who benefited from a feeding tube, and another where the better choice was to make the person comfortable. It can be helpful to remember the 3 Ds: decide, discuss, and direct. Direct meaning to write down your instructions and tell people about your healthcare wishes. Most importantly, discuss your healthcare wishes and talk about your decision with your family and friends. All 3 Ds are important: decide, discuss, and direct. Now let's move on to talk about hospice care. Instead of fingerspelling H-O-S-P-I-C-E, I will use the sign for hospice. I will clarify for you some of the things that hospice does, as well as some of the things that hospice does not do. But first, I'll explain briefly again the sign for hospice that we use in Minnesota. And as I said before, you don't need to sign it this way. It's always your decision when creating a new sign. But in Minnesota, we decided to use H near the heart because we combined the H that is used in the sign for hospital with the sign for help. Hospice care is available 24 hours a day, 7 days a week. Hospice takes care of you in one of 4 places, either in your home, or in a special hospice area of the hospital, in a residential hospice home, or possibly even in a nursing home. Many different people will take care of you in hospice. They have doctors, nurses, hospice volunteers, social workers, and many other professionals. You can also have your friends and family help take care of you too. Volunteers, nurses, and home health aides will even come to your home and help you to change the sheets, clean, and make sure that you're on the right medication. There are many different people who are involved, and they care for you on a daily basis. If you're wondering why they've come up with hospice care now, it's because the hospitals are very full, and there isn't enough space or enough staff to care for you properly. So doctors have approved hospice care to be given to you in any other setting that you wish. Hospice care is wonderful. Hospice care is special care for people who are very sick or terminally ill. Hospice care isn't for people who are sick with an illness like bronchitis or depression. It is only for people who are very ill with perhaps 6 months to live. If a person has a medical prognosis of 6 months to live or less, then they are eligible to receive hospice services. Does this mean that a person who goes into hospice has to stay with hospice care forever? No, that's not what it means. If by some miracle the person is able to recover, they can leave hospice care. And then later down the line, if that person needs to go back into hospice care again, then they can do that at any time. Hospice care is not just for old people or for people who have cancer. It is available for people of all ages. It is available for children who have cancer or leukemia. It is also available to people who have emphysema from smoking or for people who have had a stroke. Hospice care is available for people who have AIDS or people who suffer from heart failure. Everyone is eligible if a doctor declares that person has 6 months to live or less. Whenever the doctor makes a prognosis of 6 months to live, then that individual is eligible to receive hospice care. Hospice care is wonderful. It is 24 hours a day and 7 days a week. Hospitals are not always good places for people when they are nearing death. Hospitals are not equipped to give focused care to people who are dying. Hospice staff can be much more attentive to a patient's needs, and besides nurses and doctors, they have access to many resources, like volunteers, and they include your family and friends. A hospice care team is made up of several different people. The hospice team includes doctors, nurses, home health care aides, chaplains, volunteers, social workers, and others if needed. They all work together to care for the hospice patient. I'm currently visiting a man who is on hospice. On one of my visits, the hospice social worker also happened to be at the patient's home. Because I am hard of hearing, I sometimes am able to facilitate communication between the social worker and the patient. The patient's wife felt more comfortable with the communication when a deaf hospice volunteer was present. I've been to several hospice team meetings. At the meetings, staff discuss patient needs. They even discuss small things to make a patient feel better. One patient wanted some soda, and another patient really enjoyed having his dog with him. Hospice volunteers have to remember to keep information about their patients confidential and within the hospice care team. They can share information only with other hospice team members. Participating as a member of the hospice team is a good feeling, and I'm sure that you would feel the same. I would like to share with you some true stories that show how deaf hospice volunteers have helped patients in the past. Our volunteer program started 5 years ago with only 8 deaf volunteers. As one of the hospice volunteers, I had an opportunity to visit a hospice patient named Carl. Carl had a brain tumor which affected his ability to sign. He was limited to nodding his head and facial expressions. One day, it was beautiful outside, and I knew that Carl enjoyed looking at the trees and the birds. I took him outside to enjoy the beautiful day. 2 hearing volunteers joined us, and while we were visiting, I noticed that Carl was slowly moving his left hand, which rested on the arm of his wheelchair, into the shape of the letter T. I immediately recognized that Carl was telling us that he needed to go to the bathroom. The hearing volunteer asked, "How do you know that? He's not using his arms to sign." "But look," I said. Even though he could not move his arms to sign bathroom, he was able to form the letter T with his hand. Deaf people can pick up on the smallest movements, gestures, and body language very quickly. This is why deaf volunteers have an important role to play. A while ago, I went to the hospital to visit a friend of mine who had had heart surgery. Her sister-in-law, who is deaf, visited her a lot while she was recovering. My friend was very weak from surgery, so she wasn't able to move her arms to sign. But one day she made a W with her hand by her side, indicating she wanted some water. It was barely noticeable. When the nurse entered the room, we told her our friend wanted water. The nurse was puzzled by how we knew this because she could not see how this was communicated. But it was not difficult for a deaf person to see the sign for water. This is a small example of why it is important for deaf patients to have access to a deaf volunteer. My final story is about an elderly deaf woman. The hospice chaplain had asked for deaf volunteers to come and visit her, so my girlfriend and I went to meet with her. Before we entered the room, the chaplain told us that he wasn't sure if the elderly woman knew her husband had died. So we thought, okay, we're going to have to be careful about that. We went into the deaf woman's room and we chatted with her for a while. She showed us pictures of her husband and remarked, "My husband died last November 8th. We were stunned. So we went to the chaplain and said, "She knows that her husband died. In fact, she knows he died last November. She was very clear about that." The chaplain was surprised that she was able to communicate so clearly with us. My girlfriend and I assumed that she was not comfortable sharing her story with the hearing chaplain because he could not sign. This is another example of why you might want to consider becoming a deaf hospice volunteer. We encourage you to establish your own deaf hospice volunteer programs in your state. It's a wonderful experience and provides a great service to other deaf people. We need to help each other because we're one big family, right? If you need help setting up a deaf hospice organization, feel free to contact us. We'd be very happy to help you. We have resources like videotapes and other materials that we can share. Now, where do you think most people get hospice care? That's right, at home. In fact, research has shown that 95% of people would actually prefer to die at home. But it's important to remember that hospice care doesn't refer to a specific place. It's not a building, and it's not a hospital. Hospice care refers to the special kind of care that people receive as they're nearing the end of life. Remember, it's not a specific place like a building or a hospital. Is that clear? Now we will address the question of who pays for hospice care. Don't worry, Medicare pays for hospice care. The way it works is that Medicare pays hospice about $115 per day, and they care for you with that money. If you have a supplemental insurance policy, like Blue Cross, Blue Shield, Medicaid, or another plan, most of these plans have a hospice benefit as well. But if you don't have Medicare or a supplemental insurance policy, don't worry about that. Hospice care is available for everyone. No one is turned away from hospice care because they cannot pay. Hospice programs must raise money through grants, donations, gifts, and other fundraising activities. Hospice has wonderful resources to help everyone get the care they need, even if they can't afford all of their services. To summarize, first we discussed healthcare directives. Healthcare directives are instructions you write down telling others what you want when you're nearing the end of life. Remember, healthcare directives only apply to situations when you are very sick or seriously ill. They do not apply to non-threatening illnesses. We also talked about choosing a healthcare agent, someone who will stand up for you and follow your wishes when you can't speak or sign for yourself. It's very important to select someone who will be strong and someone that you trust. Trust is very important. And remember to always discuss your wishes with your family. Let them know what you have decided so they can respect your decisions and follow your wishes. Also remember to write in your healthcare directive how you feel about medical procedures like CPR and DNI. Be sure to document that. Make sure that people understand how you want to be cared for at the end of your life. Later, if you feel differently about what you wrote down, you can always change your healthcare directive. Once you sign a healthcare directive, it's not set in stone, and you can change your mind at any time. They are very flexible. They are your decisions, and it's important to remember that. I also talked about being a deaf hospice volunteer. Again, I'd like to encourage you to set up a deaf hospice volunteer program in your state. This can help you take care of your people. I would encourage you to look up your local hospice organization in the Yellow Pages. Call them about establishing a deaf hospice volunteer program in your area. If you have problems or questions about establishing a program, feel free to suggest that they call our organization in Minnesota. We can help them get started with materials and advice. Again, it's to help you take care of your people. Don't let hearing people control you. You have the right to take care of yourselves and your friends.